Good afternoon. My name is Dr. Jeff Gelblum. I'm here on behalf of First Choice Neurology. We are offering this informational informational upload for all of you who are concerned about what role does COVID-19, coronavirus, play if one is suffering from a neurological condition. As all of us know, COVID-19 is a disorder that requires one at this point to remain in somewhat of a state of isolation. And that can impact significantly on many of our neurology patients who require to go out. For example, we all know someone who may be suffering from a Parkinson's disorder or someone who has a physical impairment such as a lumbar radiculopathy, a walking disorder. And with that, it's very important to maintain exercise to make sure that one is not in a setting of isolation or lack of physical activity. So the purpose of today's discussion is to give some pointers as to what we can do with a neurological disorder vis-a-vis COVID-19 and how this is going to impact on your good care and treatment. First off, it's very important to make sure that in this setting that we all make sure that we take our medications, because as you may know, folks with epileptic seizures, folks with Parkinson's disease, people who are taking blood thinners for stroke prevention, all of these medications need to be taken on a very strict schedule. So if your schedule is thrown off or if you're unable to access your prescriptions at the pharmacy, that's a very big problem. So I'm recommending that all of our patients make sure that they have at least a 60-day supply of medication in their house. Unfortunately, with a lot of insurance companies, they're only going to give you a 30-day supply, but it's important that we try and get as much stock of medication as we can in case if we are going to be hunkering down for a long period of time. I can say right now that the probable hunker down time frame is going to be at least 2 to 4 weeks, maybe even longer. What is the purpose of hunkering down? Purpose of hunkering down or social distancing is to make sure that we can flatten the curve. So what does flattening the curve mean? What we've known for the past 600 years, actually probably more, 700 years, since the time of the Venetian Republic in Italy, is that if we can maintain physical distance between ourselves and other people who may be infected, then that will prevent a spike in the epidemiologic infection rate. So if you can flatten the curve, prevent that spike, then what happens is you're not going to have a huge quantity of sick patients all at one time, and that's critical. Just as you know how difficult it is maybe to buy toilet paper right now at your grocery store, imagine if that were to happen if 100 people showed up at our local emergency room. I know we've got folks watching today from Miami, from Baltimore, from Philadelphia, even from Paris, France. You can imagine what would happen if all of you got sick at the same time and hit your ER. That could be quite a catastrophe. It could possibly cause a collapse in emergency services at the hospital. So the whole idea of flattening the curve means that we have to social distance, means that we have to keep at least 6 feet apart from other people, including our parents, children, etc. Now, obviously, if we're all healthy, then we should stay social distanced within the home environment. In our office, for example, we're making use of telehealth, which means that our follow-up patients do not have to come to the office. We can communicate to you via our Helo app. So we have all sorts of mechanisms whereby we can reach out to you and interface with you and physically examine you, just like I'm looking at you right now, and I can see what your facial strength is, what your movement is, what your strength in the hands is, what your ability to hear and see is. So all of this can be easily assessed and evaluated via the technology that we have available to you each and every day. So for those of you who are seeing your doctor in a follow-up setting for chronic disease, it's very important for you to ask that practitioner if they can provide their services via telehealth. And telehealth is something that we've been doing for several years in our practice, and we're now going overdrive on telehealth. Initially, telehealth was developed for those patients who were too busy at work, didn't feel like driving, were traveling out of town. So that was the initial intent of telehealth, but in actuality it has transformed now in light of this COVID-19 pandemic, such that we're making use of it for all follow-up visits. So if you have a neurological disorder or any type of neurological disorder, it's very important that if you have to go to the doctor, you call and see if they have a telehealth modality. Because the whole idea of social distancing is you want to stay at least 6 feet apart from a stranger. And that's the best practice of medicine, and in so doing, we are flattening down the curve. And by flattening down the curve, we're going to lower the rate of transmission so that our health system is not inundated with emergency sick people, because if there's too many people that show up at the emergency room all at once, well, that could cause a failure in the ability of the emergency room to function. It could also cause a depletion of hospital beds, obviously respirators, etc. And I want to remind you that people get sick each and every day from things not associated with coronavirus. So God forbid somebody has a heart attack, or you have a child that has an infected arm from falling down, or somebody develops appendicitis. All of these things entirely unrelated to COVID, then of course that's a big problem if you have to access emergency care. So that's why when we use the term social distancing, we mean 6 feet apart, and in so doing, we are lessening the chance of spreading this communicable disease to someone else. And at this point, I think we have to be very civic-minded. We have to say to ourselves, well, if I feel fine, that's great, but perhaps I could possibly be in a carrying state, and in so doing, I don't want to risk the infection of another person. Young people, as a rule, tend to feel immortal, and that's the blessing of youth. However, it's very important that young people also maintain social distancing, because if they are exposed and are asymptomatic, meaning without any symptoms whatsoever, then at that point they could be infecting their grandma or their grandpa. So all of this is very important on a civilization-wide basis, on a social-wide basis, and I think it's important to communicate to all of our young family members, all of our young friends, anybody. You want to go out, great. Go outside, go ride your bike, go take a nice walk outdoors. Living in Florida, it's the ideal environment for that. But young people really need to stay away from house parties and all of the other types of situations where they might be transmitting, unbeknownst to them, the ability to acquire the virus and then infect that virus into one of their older loved ones. And remember, older folks are at most risk. For some reason, the COVID-19 virus has an increased predilection in terms of mortality for older folks, and particularly those folks over age 80. So if you are having someone in your home, elderly person, then you, of all people, need to maintain social distancing. And I want to remind you, social distancing is not the same as social isolation. You don't have to crawl under the covers for the next 2 weeks and not talk to anybody. Down here in Florida, in California, I know we've got participants there. The weather's gotten nice. It's now mid-March, and the weather's opening up. Springtime is here, so I expect each and every one of you who are practicing social distancing to go outside, get your vitamin D, get your fresh air, but just make sure that if you're working on an outdoor recreational gym, or they've got the hanging bars or the monkey bars or all of that stuff, I think that it's important that if you're going to touch those apparatuses, that you make sure you have your handy wipes on your bike or in your little outdoor fanny pack, so that you can wipe your hands down before and of course after. But social distancing does not mean social isolation, and it certainly does not mean that you have to be stuck at home doing nothing. Now, what do we do with family members? Let's say we've got a grandfather with Alzheimer's disease. Let's say we've got a mom with Parkinson's disease. She's rather immobile. maybe they have difficulty going outdoors, maybe they reside alone at home. What do we do in that situation? Do we bring mom to live with us, or do we go and live with mom? Well, if mom is independent, is functionally independent, then probably the best thing you can do is bring mom outdoors, stay 6 feet away. That's part of the social distance algorithm. Stay 6 feet away. And in terms of meal preparation and all of that, do what you have to do in the kitchen. Bring mom a carry-out meal if necessary. But there's no need at this point to hug and touch and kiss. And I know that that's very, very difficult when we have older folks at home, because old folks need companionship and they need that tactile love that we can provide as family members. But at this point of time, in an abundance of caution, I would have to advise that when you're visiting your mom, when you're visiting your dad, if they are elderly, that hugging, kissing, embracing probably should be held off for the time being. Because remember, we could all be asymptomatic carriers. Unfortunately, as the situation stands in the U.S., we don't have broad spectrum screening. So if somebody comes to my office and says, oh, I want a COVID test, I can't give it to you. And there's no place that I could really send you to go get that unless you have specific risk factors and symptomatology. So at this point of time, despite what you may be hearing from certain authorities, there is no mass COVID screen for you to take. So you can't go to Walgreens, you cannot go to CVS, you can't go to Walmart and say, I want a COVID test, like you want a pregnancy test. Doesn't work like that. So therefore, it'd be great if we had the opportunity to do broad spectrum screening. So right now I could figure out if I'm a COVID carrier, knowing that if I'm going home to hug my mom, I'm not going to transmit a disorder, but unfortunately, we don't have that. So therefore, I'm getting back to this point of social distancing, social distancing, social distancing. 6 feet, 2 arm lengths. The width of your spread, that is what would constitute good social distance. And I recommend that whether you're riding the bus, whether you're at the supermarket, whether you're at the pharmacy, just stand back and take your space. Be somewhat British and less Latin, and we will get through all of this. But social distancing, as I said earlier this afternoon, was developed by the Venetians in the 14th century as a way to protect their republic from infectious disease. So this is a tried and true methodology. In fact, historically speaking, going back to the pandemic of over 100 years ago, as well as the severe influenza epidemic in Mexico not too long ago, social distancing is what actually got that curve down so that the health system did not collapse. So social distancing is the most important thing that we can all do. Now, obviously, we have to impose that if we are going to visit elderly parents. If you have kids in the household, what do you do with kids and social distancing? Well, if it's just a nuclear family, mom, 2 kids, a dog, you're all okay. You do not have to maintain a social distance. You can hug your kids as long as everybody's healthy and asymptomatic. Because honestly, people in midlife and our youngsters and young people are really not as great at risk. But if you are over 80 years of age, you are at significant risk, and there's significant mortality associated with that. So if you're going to visit your mom this afternoon and bringing her your homemade chicken soup with a fresh-made bread, social distance, leave it on the table, step back, come on, Mom, let's go outside, let's have a nice chat, let's look up at the sunshine, let's get some vitamin D, let's get some fresh air. So clearly social distancing is imperative with our older loved ones. And again, I want to remind you, you need to stay in touch with this population, not only from an infectious preventive health basis, but older people more than anyone require good human interaction. So getting on the phone just doesn't do it. So I encourage all of you to do as much visiting as you need to do with your older family members, but again, social distance. That is the key. We probably don't have to worry about such arm's length barrier with our younger family members, not with our children, not with our spouses, if we're all under the age of 70 or so. But over that age group, one has to really maintain good social distancing. I also want to remind you that as it stands now, you probably have nothing to fear from your pet dog or pet cat. This question comes up all the time from some of my patients. Should I social distance from my dog? Where does that come from? Recently, I believe it was in January, in Hong Kong, a patient who had tested positive for COVID-19, the mouth of the dog was swabbed, and it showed low viral levels. So the question, of course, is, can humans infect dogs, or can dogs infect humans? I can tell you that that case in Hong Kong is the only isolated example of a dog with COVID-19. So at this particular time, it's really not, you don't have to be fearful of your animals, and I certainly wouldn't recommend social distancing from your animal. And if mom or dad, your elderly mom or dad, has a pet dog in the house, this is all fine. The likelihood of your petting the dog and then the dog transmitting the COVID-19 to grandma is really not a significant concern at this time. Now, maybe it'll be a concern in the next several months. We don't know, but I will tell you at this point in time, based upon evidence, and that's what we're here today to talk about, based upon evidence, there is no likelihood that you will infect your dog or your dog will infect you. And in fact, I've been recommending for quite some time, even before the COVID-19 pandemic, that older folks adopt a dog, because I think it's a wonderful way to maintain good social engagement. Older folks, as a rule, tend to be lonelier than younger folks. So with that being said, I think now more than ever, we need to support older folks and make sure that their animals are taken care of. And we also need to make sure that we don't start to say that animals in and of themselves are carriers, or I should say domesticated animals, such as pet dogs and cats, are considered at this point in time to be carriers. What's the history of COVID-19? Well, of course it came out of the animal population, but that was the wild animal population. It is considered to be perhaps endemic in the bat population, and then somehow in Wuhan, China, it jumped immediately to the human population, and of course that's the epicenter. That's the epicenter of the infection, and then it spread out from there. I want to put to bed all of these conspiracy theories that are going out there on Facebook, everywhere else. Oh, it's a nuclear weapon, it's correlated with 5G cell phone utilization and somehow created something out of nothing. The coronavirus has been around for millions of years. It was implicated in the SARS epidemic. It was implicated in the MERS epidemic, of the Middle East. That was, of course, derived from a dromedary camel. The SARS epidemic was also from a feral population, a wild population that then jumped into the human population. So viruses jump into humankind all the time. If we go back to the HIV epidemic, of course, the HIV virus may have originated in a monkey population and then somehow jumped into a human. And in this area of population expansion and global warming, where humans are impinging on feral wild animal populations, you're going to see this transmission potentially from animals to humans. And this is not going to be our first experience with a wild virus that suddenly gets into the human population. So for all of us watching, I think it's very important to recognize that this may be our first time at the rodeo, but it's not going to be our last time at the rodeo. So that's why the social distancing, which has been in practice for 700 years, invented by the Venetians, is something that we can all easily adopt today. And this is what I tell young folks. My grandfather was told to go to war and fight a battle against the destruction of civilization. We're just being told to social distance. So we need to put things into perspective, and we need to make sure that there's no panic here, and that social distancing is probably the easiest thing that you can ask of yourself as a member of the American society, as a member of the human race, to prevent transmission of what is a potentially deadly disease in older folks. So, the epidemiology of COVID-19, significant risk factor in older folks. That's why we social distance, we social distance, we social distance. 6 feet. In my waiting room, the only people who are coming in here are brand new patients who I have to physically examine, and we never allow more than one patient in the waiting room at any time. And we have our new patients scheduled in such a way that they're staggered so that no two people can ever interact. And then in terms of follow-up, in terms of maintenance care, we use telehealth through our Helo app, Healow. And this is something that all of us should be inquiring of our healthcare providers. Hey, do you have telehealth capability? Because I am in full social distance mode. And by social distancing, we bring that epidemiologic curve down, we bring that epidemic curve down, such that the likelihood of everybody getting sick at the same time and hitting a hospital where those resources will not be sufficient, that likelihood goes away. So this is a life-threatening recommendation. It's not a hard recommendation. Nobody's asking anyone to take any special medication or to take any special vitamins or do anything unusual. What I'm asking you to do as your physician at this time is to say social distance 6 feet away from everyone. And we'll get into that habit. We will get into that habit over the next few months for as long as this pandemic persists. It looks like at this time China has turned the curve, so its COVID incidence is declining, so that's all very good. So we know that there's an end to the pandemic. There's light at the end of the stomach, light at the end of the stomach. At the end of my stomach, there's light, and of course at the end of the epidemic, there will be light. So we're winding down in China, and we're probably ramping up in the United States. So we can see what's happening in Italy, we can see what's happening in Spain, we can see what's happening in France. They're about 2 to 3 weeks ahead of us. And if the worst thing that we have to do is hunker down for 2 weeks or 3 weeks and social distance, well, that is not a very large price to pay for the well-being of our world. And it's something that I have no difficulty recommending to all of my patients. So let's talk specifically about neurological conditions. Parkinson's is one of the things that I see each and every day in my practice, now on telehealth before I actually had the patient coming into the office. It's very important that Parkinson's patients maintain a high level of physical functioning. That may be hard to do if your gym is closed. That may be hard to do if your boxercise class or your jazzercise class has shut down. And I can tell you that for quite some time, we neurologists have recommended vigorous physical activity for our Parkinson's patients because they need these broad, expansive movements to prevent the contractures, the rigidity that is part of Parkinson's disease. So what do we do with a Parkinson's patient who suddenly is home confined or may not have a great backyard or may not have the ability to go outside or may be unsteady or unstable and fearful? If we say, hey, just go out and walk in the street, that might be difficult for some Parkinson's patients. So what I'm recommending, believe it or not, if you can pull out the old Jane Fonda exercise tapes from my childhood, then that's a great way to maintain the type of physical activity. And maybe Jane Fonda is watching this, but I'm telling you, if you can find those old exercise tapes on YouTube, and if you are a Parkinson's patient, well, that is a great way of preventing a relapse into the rigid state. And that is why always with a Parkinson's disorder, we recommend maintaining daily, vigorous, expansive physical action to make sure that we don't go into a state of rigidity or contraction. So if you like an exercise tape, if you can dig up some old Jane Fonda videos, these are the types of things that I highly recommend for my Parkinson's population. And I recommend this as well for my stroke patients as well. And the reason why I say stroke is because oftentimes with stroke, we've got a contracture that needs to be exercised. Well, right now, the likelihood of going to a busy physical therapy center is minimized because you don't want to be in a busy physical therapy center. Remember, the demographic of a lot of neurological diseases is older folks. So each and every day in my practice, I see older folks with Parkinson's. Mean age, over age 65. Every day in my practice, I see patients with stroke. Mean age, over age 65. What's the first thing that I recommend to all of them? Physical therapy. Well, that's great, except if it's a busy physical therapy center where I don't want them interacting. I want to maintain good social distancing. And that not only has to deal with other participants at the physical therapy center, but with the therapists. So therefore, one of the best things that we can do, all of us, is access some good exercise videotapes. And again, dig up those old Jane Fonda tapes, dig up those old jazzercise tapes, dig them all up. And with a parent or loved one or a friend with Parkinson's disease, offer them that opportunity, because that is very, very important to maintain the flexibility that will prevent further degeneration, physical contracture from the Parkinson's disease or from the stroke, where people tend to get into a stiff state. So the main thing that I can recommend at this time is please take advantage of the video interface, high-tech resources that we all have, so that if we are treating someone or having a loved one or friend with a physical disorder, such as Parkinson's or such as stroke, that it's imperative that they maintain their physical functioning. Now, obviously, down here in Florida, if the traffic isn't bad, I highly recommend going outside. In fact, for the younger folks who are watching this, you should be outside every day. There's only so much CNN and Fox News you should be watching. You don't need to have a minute-to-minute update of the number of new COVID cases in Duluth, Minnesota. That's not going to help you. But what will help you is going outside and getting as much fresh air and vitamin D, filled sunshine, as you can possibly get. So that's why living in Florida, there's the outdoors, go. In fact, when we're over with this Facebook Live, have your lunch, go outside. It'll be the best exercise you've probably had in a long time, and it's a heck of a lot better than hanging out in a dark gym. Now, obviously, we can't hang out in dark gyms anymore, but you just might like starting an outdoor exercise regimen, and you will see that not only do you get the benefits of the vitamin D from the sunshine, which helps with immune competence, but you are also going to help with aerobic. And it's just great for your mind, because there's only so much news you can watch. And what I recommend, is that when we're done with this Facebook Live, get off of social media, because so much of what you're seeing on social media is conspiracy theories, homeopathic remedies, gargle with 1 part elixir of licorice, to 9 parts elixir of lemon juice. There's a lot of misinformation out there. And what I'm hopeful going forward with our live COVID updates, again, geared from a neurological perspective, but pretty much applicable to health in general, what I'm recommending is that if you have any questions, call your doctor. If you're worried about a condition that's unrelated to COVID, chest pain, call your doctor. If you're having difficulty breathing because of asthma, call your doctor. And if you're not febrile and not having a cough, chances are it's not COVID, and you should be able to engage with your doctor on a telehealth basis. And fortunately now, telehealth is an approved modality across all insurances, including Medicare, Medicaid, TRICARE, military services, Department of Defense. So if you want to engage with your doctor, call and make a telehealth appointment. Tell the doctor that I wish to be seen in a telehealth format because I wish to social distance. I'd like to take a couple of questions that have already been sent in, and so maybe we can address some of that. And again, I'm going to gear this more toward a neurological discussion, but if it's a general COVID question, if I'm able to answer it, I will. If not, please feel free to contact me and I can respond at a future time. I have a question from one of my epilepsy patients. What do they do in terms of maintaining their ability to get medicines if their insurance only covers 30 days? And what do they do if they need a blood test follow-up in order to see how their anticonvulsant levels are? Well, clearly at this point in time, you should all be sitting with at least a 30 to 60-day supply of medication. There's no need to wait till your last pill of phenytoin, Dilantin, before calling the doctor to make sure that you get a refill. So please keep a 30 to 60-day supply of medication on board. Also, if you need to have a blood test, go have that blood test, because we neurologists live, breathe, and die by blood serum levels of anti-seizure drugs, because as you can imagine, if the patient's blood level of their anti-seizure drug, if that blood level drops too low, then the patient is at risk of a life-threatening convulsion. And the last thing you want to do is end up in the emergency room with a seizure that's preventable if there may be COVID patients there. So that's the last thing you want to do. So I'm recommending that you go to the lab if your doctor recommends you're having a blood test, or if the blood is done in the doctor's office, so much the better. But if you have to go to the lab, go very early. Try and get there 7 o'clock, 8 o'clock in the morning before it gets crowded. Don't hit in the middle of the day. One of the questions that I have from one of our visitors today is, should we be concerned about who prepares the food that will be delivered? Well, here's the good news. Would I be eating uncooked raw food right now? No. I would go back to the good old Italian way, which says if it's fried or sitting in a boiling, bubbly red sauce, then chances are it's going to be okay. And that is true because, remember, heat kills corona. Corona cannot exist at cooking temperature. So if you're receiving good hot food, then you probably have no reason to worry. Would I be ordering a salad delivered? No. But why would you ever have a salad delivered? How lazy can you be to not make your own salad? So the major issue at hand is, would I be getting raw food, let's say sushi? At this particular time, delivery sushi is probably not something that I would be recommending, because again, even though the food preparer is healthy, could they be a carrier? Possibly. So therefore, I think it's important to rely upon, as they used to say in Italy, nonna's cucina, grandma's cooking, which was always in a big bubbling pot filled with lots of steamy red sauce and cooked meats. You'll never have a problem with that. One of the questions that I've just been asked is polyneuritis considered an underlying condition? And these are great questions. Does polyneuritis is an inflammation of the nerves of the fingers and the feet. It can come from many disorders, diabetes, it can come from previous infection, it can come from autoimmune disorder. At this particular time, we do not believe that polyneuritis is an underlying predisposition to the COVID unless that polyneuritis is treated with an immunosuppressant regimen. So let's say you have an autoimmune disorder and your doctor says you have polyneuritis, meaning that's the cause of your numbness, tingling, fingertip irritation. If you have that type of polyneuritis where your doctor has put you on an immunosuppressant medication, Imuran, azathioprine, you would know the name. If that's the case, probably you are at increased risks from an infectious disorder like COVID. So polyneuritis per se is not considered to be a risk factor unless you are on a immunosuppressant treatment. All the more reason why you should call your doctor and say, listen, if I'm on is my medicine an immunosuppressant? You would probably know that by now, and I would think at this particular time your doctor should have reached out to you and said, look, you really have to practice social distancing because you're on something that could potentially impact the immune system. One of the other questions that we've gotten is, should COVID patients stay away from NSAID analgesics? Again, there's so many rumors going out there on social media, Facebook. That's why as soon as we're done, you're going to log off Facebook. You're not going to stay on this platform any more this afternoon. Maybe you're going to log back in tonight to post a picture of your good home-cooked lasagna and not your salad that you brought in. But the NSAID analgesic avoidance is a myth. It's an absolute myth. There is no evidence-based data to suggest that NSAID analgesics in any way amplify COVID infection or suppress immunology. Therefore, I am obviously advocating that your first line of defense if you have a fever is acetaminophen, because probably it is easier on the stomach than an NSAID. And that's why in my medicine chest, for my patients, I always recommend you have a fever, take Tylenol. And of course, it's much safer for kids because we know the kids have a predisposition to develop Reye's syndrome, aspirin-related toxicity in the face of a fever. So if your kid or your mom or you have a fever, COVID, otherwise, best thing you can do is take 2 acetaminophen every 4 to 6 hours. One of the other questions that we have is colloidal silver. Is colloidal silver, should I be wearing silver? Should I be wearing silver jewelry? Should I bring out my great-grandmother's amulet that had, some kind of silver decoration on it? There's nothing about colloidal silver that is in any way anti-infective, and unless you're covered head to toe, like the man in the Iron Mask, there's nothing protective about silver. There is some suggestion that perhaps copper could have an anti-infective surface, but again, that would apply to a copper top kitchen cabinet. There's no way that you're going to wear copper to ward off a viral attack. Copper primarily is more antibacterial as opposed to antiviral. Should you suddenly cook in copper because it's got some anti-infectious benefit? No, don't waste your time with that. And again, the only protection that copper has historically, maybe it does have an antimicrobial aspect, but as long as you cook your food, as long as the food that's delivered to you is piping hot, if you're bringing something for a family member, bring them hot cooked food. It's probably tastier anyway, and gosh knows your grandmother is not going to appreciate sushi taken from the carryout. So just make something nice in a stew pot, and that'll be the best thing, and then they can heat it up, and they can have a meal for a few days. What do we do if we have a fever? Can fever over 100 degrees help mobilize our immune response? First of all, fever doesn't mobilize a immune response. Fever is a reaction to the immune response. So I am always advocating that if you have a fever, being in the febrile state is not a benefit. First thing you want to do is suppress a fever, because being in a febrile state is not immune boosting. It's a reaction of your immune system. So I can tell you that at this time, you get a fever, you take Tylenol. And remember, the cardinal features of COVID-19 are fever, cough, and upper respiratory types of symptoms, meaning wheezing, etc. And assuming that you don't have asthma, if you start to develop those types of symptoms, those are the cardinal features, and that is something that you have to be very mindful of. Again, I'm still getting this question about colloidal silver is actually medicine. Yes, I know it's actually medicine. It's very useful for a bacterial topical wound. It doesn't have any basis in an anti-COVID treatment regimen. At this particular time, I'm not recommending it for anything. So let's stop with the colloidal silver. Let's stop with the copper drops. Let's stop with melting down all the jewelry that stayed in the family collection, because smelling it, ingesting it, snorting it, or putting it in an orifice is not going to provide you any significant immune benefit. And the most important thing that you can do if you are feeling symptomatic of the COVID virus, basically if you're under 70, acetaminophen for fever, over-the-counter decongestants if you feel stuffiness, and then of course fluids, fluids, and fluids. Why are fluids always important in the face of an infection? It's not because you feel good drinking your Aunt Ethel's chicken soup. What fluids do is actually pump the lymphatic system, because it's the lymphatic system that drains out the infection. And once the time you have a fever, your lymphatic system, your immune system is now recognizing that you have an infection. The problem with COVID, of course, is it maintains a latency, a subclinical latency, for a period of perhaps up to 2 weeks. So you may not even know that you're infected, and because it's a new virus, brand new to the human experience, it's going to take your body a while to figure out that something is there that doesn't belong there. So that is why there's a long subclinical latency period where you may not even realize you're infectious, hence the need for social distancing, social distancing, social distancing. And then beyond that, if you are sick, the most important thing you can do is chug the fluids, because that activates the lymphatic hydraulics, which can help drain out the infection from your body, and then acetaminophen and decongestants, and then bed rest. And for most of us, for probably 90 to 95% of the population, you will experience a flu-like illness of the upper respiratory symptoms that we've discussed, and that will be that. It will be self-limiting, and then you will have immune competence, and you won't have to worry about getting it again. The problem is, it is not a good idea to go and seek out a COVID infection, because during that time phase, when you may be subclinical, you could actually infect an older person and they could die. So I am not advocating in any way, shape, or form that people say, oh, let me just get it and be done with it. Not a good idea. Because of the long latency period, because of the long subclinical incubation period, there's an extreme tendency that you could actually infect someone who isn't going to mount a good immune response, and they could die. So I don't advocate people going out saying, oh, I just want to get sick and be done with it because I'll survive and everything will be fine. It won't be fine if you touch grandma or grandpa or an old person at the grocery store, and they may not be able to have the same degree of immune response that you will have. So let's summarize very briefly, and then we'll be back on Friday for our next COVID neurologic update at 12:30 Eastern Time. Again, I want to just summarize social distancing, 6 feet in all settings, except if you're at home with your kids. But with a loved one who's older, take them outdoors, 6 feet away, have a nice conversation about the good old days. And if you're bringing meals to that loved one, great, put it in the kitchen, and then stick it in the refrigerator and let them reheat at a later time. Can you take ibuprofen? Again, I'm going to remind you all, there is no evidence-based data at this particular time that NSAID analgesics or that NSAID anti-fever agents, ibuprofen, Aleve, Motrin, that those agents are in any way exacerbating the COVID disorder. If that is your anti-fever agent of choice, you may take it. My anti-fever agent of choice has always been acetaminophen, because I find it better tolerated for people who are taking blood thinners like aspirin and for children. So acetaminophen should be stuck in your medicine cabinet anyway, irrespective of the COVID attack. And then the last thing that I want to remind you is outdoor, fresh air, vitamin D, sunshine, plenty of fluids if you're sick to activate that lymphatic hydraulic pump. And with all of that, everybody should do just fine. In fact, the vast majority of all of us should do just fine. It's the frail individuals in our community, in our families, who are at risk. And as I always say, social distance is not social isolation. Old people need their back and forth, and they need their interaction, and sometimes just showing up on the telephone or the video isn't enough. So that's why if you want to go visit grandma, go do so, assuming that she's not in the nursing home, because that's presently probably on lockdown. But if you're going to visit grandma, great. take her outside, take her out on the terrace, take her out in the front yard, and just stay 6 feet away and bring her a nice pot of steaming lasagna, and she will be extremely grateful. And I'll bet your recipe is probably not as good as hers. So with that all being said, I'm going to wish you a very safe and happy and sunshine-filled afternoon. The good news is it's mid-March. It's not the middle of winter. We can go outside. So we have to have a smile. We have to be optimistic. We have to say thank heavens that all of us who are watching are healthy, that we're in communication, and that we have the opportunity to access, like never before, evidence-based data that can help keep us safe, secure, and we will all get through this. And as I always say, my grandfather went to war to fight against the Nazis, and family members were killed. All we have to do is social distance and go outside. How difficult can that be? Not very difficult at all. And maybe you'll learn how to cook a little better instead of doing carry out all the time. So with that, I'm going to wish you a wonderful and safe afternoon, and then we look forward to reconvening this coming Friday for some updates. And remember, it's important to log in every couple of days because the information curve is rapidly changing. And hopefully we will have some more useful information. But again, we're going to gear our discussions more toward neurological disorders. So on Friday, we're going to spend some time talking about things like dementia and migraine disorder, and how to stay well controlled with those two underlying conditions in the face of COVID-19. So I wish you all a wonderful afternoon, and feel free to email me, jgelblum at fcneurology.net, as in first choice neurology.net, jgelblum. And if there's any other questions, feel free to contact me. And as always, our office is available for new patients only to come in. Everybody else, you're telehealthing, and download our app, Helo, H-E-A-L-O-W, and make sure you do that with your other doctors. Thank you very much, and I wish you a great afternoon.